global, I think. So it's a very large area, epidemic diseases. So minimum 45 minutes here. No time. I am just going to present within 10 minutes. I am going to finish. So what is epidemic diseases? So the epidemic diseases are the diseases mostly. For example, in the recent past, many diseases. For example, swine flu and dengue fever. The outbreaks are in the Tamil Nadu also, Madurai and other districts, and even in the Kanniyakumari districts, around seven deaths for swine flu. So mostly, so these diseases, the outbreaks are very common, and these diseases are very rapid, and they are very many people getting problem at a time. So that's why the epidemic diseases are mainly these diseases. Especially on people, many people in the population, and same type of sufferings, and the cause may be same cause. So that is epidemic diseases. The cause same, but suffering similar, and many people in the given population. So that is epidemic diseases. So mostly the epidemic diseases I am not going to deep. So that's why diseases. Next slide. Next. Even in the many centuries back, okay, from 16th century, 17th, 18th, the diseases are there. Were there many diseases as epidemic diseases, but nowadays the disease may be changed, but still the diseases are there in the society. Okay. Here, these are some important diseases related to the epidemic diseases. Dengue fever, chikungunya, swine flu, even having their own symptomatology and even the investigations. I prepared that related to the symptomatology, the important differentiating features and the important investigations to find out to confirm the diagnosis. And the next slide. Basically to surgical and dynamic. So these diseases under acute diseases. Acute diseases again acute and chronic, dynamic diseases, and acute diseases again classified into individual, sporadic and epidemic. So where the epidemic diseases? So these diseases in the acute diseases. So why acute? What is acute disease? We know that the rapid onset and rapid sudden onset, rapid progression, and the recovery or death. So that is acute. So sudden onset, rapid progression. So there is recovery within a few days or weeks. There is recovery or death. So that is the acute diseases and epidemic disease under acute diseases. Next slide. And in acute, yes. So mostly these epidemic diseases in our homeopathic point of view. So there is two types, recurring type and non-recurring type. So what is recurring type? The disease recur in the lifetime, second type, or non-recurring type, or fixed type. So this type not recurring once in the lifetime, means not recurring the second type. So that is fixed miasm. So we can say that measles, chickenpox, these type of diseases not recur once came in the life. Okay, next. And how to treat the disease related to the epidemic diseases according to homeopathy. So every disease take as a new disease, and a thorough investigation. After thorough investigation, we should take the disease symptom along with the individual symptom. Based on the means we can say the totality of symptom, disease symptom and individual symptom. We can treat or select the remedy, and even after few cases, so taking the disease symptom and individual symptom, after taking few cases and treating, we can select according to homeopathically the genus epidemicus, that is the common remedy in that particular place. So we can use as a preventive in that place as a common remedy in the particular location after treating the patient. So mostly 5-6 cases after. Next slide. And next slide. So these are the preventive or prophylactic treatment for epidemic diseases in the homeopathy. So for example, chicken pox, variolinum and pulsatilla. So we can use daily one dose or after that weekly one dose. So this means we can say the variolinum, morphilinum. So these diseases are, these medicines are prepared from the disease product. So these we are giving as a no-sode. So we are giving the name no-sode. So these are prepared from the disease product. So that's why we can, repetition maybe weekly once or 3 days once we can repeat. So that remedies, pulsatilla, the first remedy, second remedy, pulsatilla. So these remedy we can repeat 3 dose or 5 days, 2 dose per day. So we can repeat. So like that every diseases it is there. So what are the preventive remedies we can use in the homeopathy for epidemic diseases? So these for one of the in epidemic diseases. So most of the even lay people they know the homeopathy having the preventive medicines. Okay. Even in the swine flu, the recent swine flu, we are using the arsal. Somewhere it is there. So arsal we are giving according to the CCH, means Central Council of Homeopathy. They are advising arsal as a preventive. Daily means daily 1 dose for 3 days or daily 2 days for 2 doses for 3 days. So that for the swine flu. Okay. And even the influenza. So that is flu. So mostly the swine flu, SARS and influenza. So these are the diseases of flu diseases. Flu means mostly the symptoms related to respiratory. Sneezing, running nose, cough, sore throat. So these are the symptoms. So that's why the medicine prepared from the influenza is a medicine prepared from the disease product. Okay, so that's why. So this medicine advised for that as a preventive, and the arsal as a repeated. We can repeat the medicine, and the influenza we can give weekly once for 2-3 weeks. Okay. And so this is the mode of treatment for preventive, mode of treatment in homeopathy for epidemic diseases. So again the symptomatic treatments are there. So important remedies for every conditions, dengue fever, chikungunya. So many remedies are there for that. So we can, according to the symptomatology, it may be disease symptom along with the patient symptom. That is individual symptom, we can select the remedy. So it's a totality of symptom. We can say according to homeopathy, totality of symptom, total symptom. So even physical general, mental general, mind of the patient, physical general, and the common symptom, and to all, even the constitution of the patient. So we are selecting. So these are the acute diseases. So mostly to chronic diseases we are seeing the totality, but acute diseases, acute totality we are, with acute totality we are selecting the remedy. Okay. So mostly very briefly I gave the presentation. So no time. Thank you. If time permits later we can discuss.